What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Why do owls turn off their cell phones at night? So they don't get a hootie call. Where do leprechauns live? In leprechaundos. Why did King Kong climb the Empire State Building? 'Cause he couldn't fit in the elevator.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heartburn, exacerbating my incredible woes. I want to take my brain now and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, broadcasting from the world-famous Cardiff Electric Network studios, right next door to hell, right, Tacie?
Right.
It's Weird Medicine that's 1,000 degrees in here. Though it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott.
I just want to say it's 1,000 degrees in here because this is a closet that should be used to keep my Christmas tree. That's why it's so hot in here.
You're mean.
It's the truth.
Okay, we got Dr. Scott. Hello, Dr. Scott.
I'm Steve.
Lady Diagnosis.
What's up?
Tacie.
Hi, honey.
And our newest friend, who is actually one of our oldest friends. He's just never been in the studio before because he lived in Saudi Arabia until now, Dr. Ahmed.
Hello, Dr. Steve.
Hello, my friend. This is a show for people who would never listen to a medical show on the radio or the internet. If you've got a question you're embarrassed to take to your regular medical provider, you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347. Take it, Ahmed.
Poohead.
Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at Dr. Steve for podcast. He's the only one that could pull that off, and we'll explain why in a second. It's stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, whatever. Just talk it over with somebody. Anyway, hello, everyone.
Hey.
It is 1,000 degrees up here.
I'm comfortable.
And we wanted to make it comfortable for Dr. Ahmed to make it feel more like home.
Feels like home, yeah.
Yes, there you go. Check it. Don't forget stuff.drsteve.com, stuff.drsteve.com for all your Amazon needs. Check out Dr. Scott's website, simplyherbals.net, and check out our Patreon at patreon.com/weirdmedicine. Weird Medicine. And also, if you just want me to say fluid to your mama or secretions or tell her that, I hope that she doesn't get chlamydia, then, and I know Mother's Day is long gone, but it doesn't matter. Those kinds of jokes to your mother are always funny. Check it out. Check me out on Cameo at Weird Medicine. And just search for Dr. Steve Weird Medicine. It'll come up. And it's very cheap. I just do it for fun. It's hilarious. I have fun doing it. And sometimes I'm driving down the road to rural Southwest Virginia, and I do cameos from there. And even Cletus or Myrtle will do it if you want.
Oh,
okay.
Hey, we're talking.
Okay, anyway. So you get the idea. Okay, thank you. So for people who don't know who Dr. Ahmed is, he is our friend from Saudi Arabia.
That is correct.
And who, massage my ego for a second. Tell us how you found this show, and somehow we were weirdly instrumental in you being here today, obviously. But had you had thoughts of going to medical school before you found this, or were you going to medical school and then you started listening to our podcast? Because I remember you emailed me like 8 years ago, right?
It was in 2013, so 9 years ago.
Whoa, wow.
Yeah.
Ooh. So 9 years ago, what prompted you to... how does this happen? You're this kid. You're a kid now, but you're this kid in Saudi Arabia, and there are these lunatics talking about medical stuff on the radio.
Yeah, well, at the time I was an Opie and Anthony fan, and then I got introduced, to Weird Medicine.
Right?
Yeah. That's how I first learned about.
Okay, so now how does that happen? How do you? How are you an Opie and Anthony fan and you're living in Saudi Arabia?
It's a long story.
Okay, give me the Reader's Digest first.
Yeah, so I was an MMA fan, and then I remember at the time Joe Rogan had a podcast on the Opie and Anthony channel.
Yeah.
And I was listening to his podcast, and then I learned that he had the podcast episodes on the Opie and Anthony channel on Sirius XM.
I vaguely remember that.
Yeah, and so I started listening to Opie and Anthony, and then I can't remember which appearance, but I learned about
Tom
you.
Prostate.
Probably. And then I learned that you had a podcast.
Okay.
So I started listening to the podcast. It was during the P.A. John days.
Okay. Yeah. Sure.
Yeah. And then at the time, I would not have thought to be a physician. It didn't even occur to me. But, slowly, I can't pinpoint a specific moment where it was like an epiphany.
Yeah.
But looking back, I don't know when, but I said, I want to be like Dr. Steve.
Oh, that's so weird.
Poor kid.
What's really weird is he's listened to every one of these shows at least once, except for the one that you were on. Because you called in like 2008 or something, right?
Yes, in one of the early shows.
Yeah. And so he's listened to every show. So I was telling him, my youngest is 17. He's going to be a senior this year. And he's like, is that Beck? And then he's like, what was the other thing that you said? It was like, remember that Andy Mayberry episode where the guy came to town and he knew everybody's secrets, but it turned out he had been getting the subscription to the newspaper. This is like back in the black and white.
No, I do not.
Okay, well, anyway, Andy Griffith's show days. Somebody out there knows what I'm talking about.
I think I do.
So Ahmed said, God, there was something that you said. It was like, do you remember what it was? You said something to me that was really kind of obscure, but it was something that only... I don't know. Anyway, we were talking all the way because I made him come to my office, and then we had an hour drive to go to hear me give a talk on hospice stuff to a medical staff, and then we drove back up. But it was funny. I can't think of an example, so that's a terrible thing. Why did I even bring it up? But it was funny that he knew so much about us because, Tacie, there isn't a single thing that you and I that's ever happened to us that we haven't eventually talked about on this show.
There are a few.
Okay, so let's ask him. The night Tacie got the maddest she's ever been to me, what part of the house did she lock
That's
me
an easy
into?
question.
Is it?
I can't. Was it the bathroom?
Oh, no. Boo.
I don't know.
Never mind. Okay, never mind. Stupid bit. So moving on.
I locked him in the basement.
Yeah, she locked me in the basement.
And that's where he
knew so many
to be.
weird things about us, and it was all stuff from the show, of course. Yeah, it's cool. But anyway, dude, it's whatever happened. We're glad to have you here. So we've been corresponding. He got in medical school, and then I actually wrote a letter of recommendation for him to get into, for residency. And then I got an email. Hey, I matched, and you're in, the southeastern part of the United States, and here you are. It's crazy.
And here I am. I can't believe it, actually.
I know, it's crazy. So very good. Well, we're very happy to have you here, and what if we played any positive role? We're all very excited about that. So.
And we hope you can be close to Dr. Steve, but no one is Dr. Steve.
Yeah, okay, whatever. Thank you. I'll just give you that. Thank you. Sorry. Okay. So, so let's all practice saying Ahmed's name. So, the name Ahmed. There used to be a show. What was that show called? Tyrant? And there was a woman on there, and her husband's name was Ahmed, and she kept calling him Ahmed. And it's like, I know she is not. She doesn't speak Arabic. And then I found out later that she was like from India or something like that. But I could tell because she didn't pronounce the middle H. And that is, English doesn't have a word like that. That's why so many people call you Ahmed or Ahmed, right?
Yeah, because the sound itself is not found in English.
Right, in the middle of a sentence.
Yeah.
We can say hotel, we can say the H sound. But in the middle of a word, it never appears in English, so it's difficult.
Yeah, but the proper sound itself in Arabic is different.
Oh, is that right?
Yeah.
Okay,
so
let's hear it.
In Arabic, my name would be Ahmed.
Ahmed. How close is
that?
that?
So that ha, Ahmed.
Ahmed.
Yeah, which is difficult to...
Okay, Tacie?
It sounded like you said Ahmed. But you did. Say it again.
Ahmed.
Ahmed. I can't.
That's closer than Ahmed.
That's closer.
Yeah.
Ahmed. But you don't want it to sound like that. You want it to sound like it's
natural. Right.
So, Ahmed.
See, it's hard.
I mean, it is very hard for us. It's going to take me some practice.
I had a guy,
for sure.
the first time I ran into that middle H sound, I had a guy on my service, his name was Adham. And I had the hardest time. It was like, what? And he'd say Adham. And I go, I'm still not hearing it. My ear couldn't hear it right. And then he said, look, it's like Adam with an H in the middle. And then I got it. So Adham.
So I have a question. I have a friend who was actually Ahmed. Is that actually a name, or were we just really fucking it up back then? He was Saudi Arabian.
Well, because in Arabic, the name Ahmed, when you speak it in English, you can go Ahmed, 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 Ahmed. And
so it's not wrong.
It's not wrong. It's some people prefer a specific pronunciation. Personally, I don't. I mean, as long as I know that you're referring to me.
If you're going to be in the South, you're going to hear all kinds. You just get used to it.
Yeah.
Ahmed, that Dr. Ahmed said he's a pretty good feller there. And Dr. Ahmed.
Yeah, if you have an odd name like I do, you simply just can't care what people call you.
Right. She gets Stacy, Tracy.
Yeah. Was it Rich Voss who said there was a birthday message they were doing for you, I think, and Rich Voss called you Stacy.
Oh, I mean, I don't even notice that anymore.
I didn't notice that
honestly.
either.
I never noticed that. And when I go through drive-thrus, like at Chick-fil-A, and they ask me, what name, I say Tracy or Stacy, because to say Tacie is just, and you have to spell it, and then you have to, and so it's just much easier to lie and give them a different name. So that's how I get out of it. So maybe that'll, help you here.
You could change it to just Med, like Dr.
Med.
Like that could be your nickname.
Okay, Scott, your turn.
I like that.
It's hard.
It is hard, yeah.
It's a very simple name. And Tacie's saying, well, if you have a weird
and more
name.
like for the drive-thru.
In Saudi Arabia, it's not a weird name. It's every other kid is Ahmed.
Ahmed.
Actually, in Saudi Arabia, most people call me by my last name.
Oh, yeah.
Because my first name is so common. So
right, if they yelled Ahmed, it's like 20 kids that raised their hand. Yeah, okay.
Ahmed.
All right, hey, check out Dr. Scott's website at simplyherbals.net. Yeah, this bit went nowhere. I thought it'd be fun if we all tried to mispronounce.
We were good at mispronouncing it. We all did a good job of it.
Well, let's see here. We had some questions. Oh, you had a really interesting question, Lady Diagnosis.
I did.
And this is one that our guest he and I were talking about this exact thing on the way up here.
So my question is, where does snot come from, and how do you have tons of it?
Yeah.
It just doesn't go away. Do we just make it constantly?
Go ahead, take it.
Sure. Well, your
He's
mucosal
answering all the
lining,
questions today.
the mucosal lining inside your respiratory tract secretes this fluid, this mucus, actually.
One question.
Yeah.
You say respiratory tract.
Yeah. So
is that my nose?
So the inner lining from your nose to your pharynx, which is, and then all the way down. But it secretes this mucosa because it helps. It has an immune function. It helps to change the temperature of the air as it goes in. And for some people, an increase in this mucosa and the production of this mucosa causes this snot. And so some people will have this feeling that there's something in the back of their throat dripping, and then they would clear their throat all the time, and then and so that would be an example of postnasal drip.
Yeah.
So you never run out of it, though.
Well, here's the thing. A couple of things. So there are cells in the nasal mucus, and actually around all mucous membranes, but they're specifically designed to produce fluid in the nose, because when you get an antigen in there that the body doesn't like, histamine is released, and there are these cells that do this thing called degranulation, and what that is they just release massive amounts for the cell. I mean, cells are microscopic, of basically hormones that cause the capillaries to dilate, and when they dilate, they open up, and what kind of junctions, Tace, open up? You know.
Yeah, I wasn't paying attention.
Okay, loose junctions open up, and then filtrated fluid in the form of mucus and just drippy snot. It's just clear. It's perfectly clear. It's ultra filtrated, and it's designed to wash that stuff out of your nose. And that's one of its. It's not designed to do anything, but through evolution, we made this process, and it's functional, so it increases our ability to fight off disease and stuff like that. Now, one thing I find is really interesting is we are, producing saliva, which is also hyper-filtrated serum, and it's more watery. And you're constantly swallowing it. And so it ends up in your stomach, and you reprocess it, and then you make more. And if it makes it to your colon, of course, the colon will resorb the water. So there's this big cycle of fluid in our bodies. And but the fun thing is, and Ahmed, you probably heard us talking about this before, but this is a fun experiment. Take a spoon and hold it in front of your mouth, and then just let saliva drip into it till the spoon is full, right? And then, regard it, see what you accomplished, and now put it back in your mouth. I know, that's everybody's, ew, it's gross. And most people can't do it. It's disgusting, except that just came out of your mouth just a couple of seconds ago.
That's true.
And you swallow it constantly.
Sense.
If you snort back, and you get a big wad of mucus from inside your nose, it goes down your throat. It's kind of maybe even uncomfortable, but you can do it. But snot it out the other way into a spoon, and then drink it. Put it in your mouth. No, people won't do that. But it's exactly the same stuff that came from the same place that was just there just a couple of seconds ago. Mm-hmm. I find that interesting. But anyway,
it is. But it just amazes me that it never stops running.
Right. I've heard Opie. One of the first questions I answered on Opie and Anthony, where I got a positive response, was they were asking me about how is it that if you eat something, all of a sudden you might have diarrhea, and it'll become voluminous and it happens so fast. How can that happen? And it's because it's not a lead pipe. It's active. The mucous membrane is active, and it can either absorb fluid or it can secrete fluid back into the lumen. And so you can secrete tons of fluid into there. There are drugs that do that. Tacie's aware of those. If you have a chloride channel activator like lubiprostone, it's sold as Amatiza. It opens up chloride channels in the colon, and those channels open up. Chloride ions flood in. Those are negatively charged chlorine atoms. And what follows them is sodium. And what follows sodium, Ahmed?
Water.
Water, exactly right. There you go.
Give yourself a bill.
Your first one of those. Will not be your last. So water floods in, and then now you've got this watery solution in there that now has to go somewhere, and it just floods through your bowel and clears it out. That's how Amatiza works as it's not a laxative, but it's an anti-constipation medication. There are other drugs like linaclotide. Linaclotide works sort of like a thing called vasointestinal peptide. What vasointestinal peptide does is turn on other channels that now flood the bowel with fluid. And so when you get certain types of precancerous lesions, they can be associated with voluminous diarrhea. That's almost always do you know what kind of adenoma that is?
A VIPoma.
Give yourself a bill.
Okay, yeah, that's right. So, villous adenoma, those are the villains. That's how I remembered that in medical school. They're the bad ones. So, so if they secrete vasointestinal peptide, then you get that. And then there are certain bacteria can do that. So you get cholera or Shigella or Salmonella, and some of those can secrete toxins that then cause the bowel to rather than absorb fluid, secrete it into the lumen. So it's really interesting. There's this whole fluid balance. There's a hypothesis that we emerged from the sea, and what cells are there to do is to enclose the ocean and carry it around with us, because it's salty in those cells. There's sodium and potassium and magnesium and stuff like that. So our bodies just basically are sacs that enclose the ocean so we can carry it with us. There's some philosophers said life was just invented by water to move it around, from place to place. I would argue that's what hurricanes were for, but anyway. All right.
Excellent. Thank you.
Excellent question.
Good question.
All right. We did the smoking thing last time. Let's see. Oh, this is a very insightful question, I think. Hang on a second.
Sorry, wrong number.
Okay, fair enough. Thank you.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Sergeant and Mr. Smith, you're going to love this house.
Bunk beds in a closet?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Hi, I'm Lara. After 20 years of Lara Bar, I still believe that simple and real can be delicious, which is why we're introducing Trail Mix Bars, a new crunchy, chewy Lara Bar made with regenerative almonds. Follow our almond journey at larabar.com.
All aboard! Welcome to the Friskies Express. Please keep all paws and tails inside the train. To the right, you'll see Crunch Canyon. To your left is Filet Falls. Now you're passing Party Mix Peak. Today's Delicioso tour is almost over. But don't worry, with Friskies, there's always more to explore. Check out friskies.com to explore more.
Let's try this one.
Hey, Dr. Steve, it's Mike in New York. Hope
Hey,
you
Mike.
guys are doing well. Everything is good here.
Yeah, man.
I have consistently, for the past several years, had a PSA of 0.5.
Okay.
And
so he has a prostatic-specific antigen of 0.5, just an indicator of what's going on in your prostate. When it gets elevated, we start worrying about just benign enlarged prostates or prostate cancer. So
And what's
in
normal?
January, it jumped up
0.5 would be normal.
to 2.99.
Okay.
My doctor said, based on my age, it's not a concern, but the factor of 6 increase makes it a bit of a concern. He said we could, out of abundance of caution, do an MRI now, or we could wait a few months and retest. We retested, and it's down to 0.7.
There you go.
So thankfully, there's nothing to be concerned about. But what could cause a PSA to jump to that level?
Excellent question.
Is there something, that happens, or is it probably a lab error or something along those lines? Just curious.
Yeah. Scott, you want to take part of this?
Could be infection.
Yep.
Could be dehydration. Could be trauma.
There you go.
Yeah, I mean, he could be riding his bicycle. Too much.
Yep. So the PSA can be stimulated in the short term by, just as Scott said, trauma. Like when we had our scope of the cystoscopy.
No, next subject.
Let's talk about
I bet if they had
that.
checked our PSA after that, just from clenching our ass cheeks
Lord.
together, it would have been elevated. So, but prostatic infection, aka prostatitis, could have caused that.
Yeah.
Every once in a while, something like just passing a massive American giant hard stool can do things to the prostate, because the front part of the rectum is the back part of the prostate. So they're right there together. When you get a big giant American rocky turd that passes past there, it can do a couple of things. You could get a tear in the mucous membrane, and you could get a few bacteria that work their way through, and you get a prostatitis. It could be self-limited. Or you could have a big boggy prostate because you haven't been emptying it properly. And so you have prostatic congestion, and then that stool just really presses on. It's like giving yourself a prostate exam. Any things that sort of just get the prostate stirred up could do that. So I'm glad it went back to normal.
Yes.
They for a while taught us this thing, PSA velocity, where they talk to you about this at all. That's good that they haven't. Okay, he's got a quizzical look on his face. At one time, we used to look at the rate of change of the PSA, and that would trigger a biopsy. And this guy back then, it went from 0.5 to 2 point something. That's a huge rate of change. The DXDT is elevated. We would have maybe sent that guy for a biopsy. They're saying now don't do that. So this stuff with the PSA keeps changing. For a while they were saying don't do PSAs, and then now they're saying again, okay, well you can do PSAs for screening. The digital rectal exam, which by the way for the techies out there isn't something you do with your iPad. It's actual using a digit of your your first finger and sticking it up somebody's ass and feeling around. And you can feel for. We used to have a prostate simulator Did you ever see the Opie and Anthony?
Yes, I
okay,
did,
so
yeah.
see, he's seen everything. So yeah,
With your smiling face.
I sold that thing on eBay at some point. I had it here for a while. Bobo stole it. He didn't really steal it. E-Rock gave it to him, and then I demanded it back. And then we had it here for a while, and it was like, why am I keeping this stupid thing? It was just an ass with an anus.
Yeah, we have questions.
Yeah. And then these things you could insert to make the prostate feel different ways. And then, it had some nice scents. And
why did you keep that, Dr.
I don't know. I felt like it was a piece of history. It's like, what history is this a part of? So I ended up selling it at some point, or I gave it to somebody. I can't remember what happened to it.
Is that the same anatomical model that you had when we were at Anthony's house?
No, that was different.
And Liam and Beck were throwing
penises
around in Anthony's
That was
house.
a different one. That was a infant's torso, and it was a circumcision trainer.
Okay. I didn't think. I was wondering.
Yeah,
why.
it was just the torso and no legs, nothing above the mid chest. And I remember Jimmy doing Uncle Paul going, no head for Tatlin. It's like, oh God, dude. It's so bad.
Yeah, and our kids were so little too.
Yeah, so we had our kids at Anthony's house, and we were doing, at that point, it was the Anthony Cumia show. And Jennifer Hutt was there, remember? You got to hang out with her. She's lovely. Her husband, best looking man that is walking the earth to this day.
Now, I do want to say before we get further.
Yes.
Our boys had no idea.
No.
What was happening on the show.
They were sitting there. I did a circumcision, and I completely ripped the poor kid's penis off. I remember because the circumcision, it had different penises that you could put in the torso, and I didn't have it in there very soundly. And so when I put the Gomco clamp on it, the whole penis ripped off. It was
I didn't even know that. I didn't even see that
because
I was
you were focused
outside
on
watching the boys.
Yeah, you were focused on the boys.
They got into the bag.
They got into the bag of dicks. It was
just
literally
like
a bag of
little
dicks.
kids would do.
And they were throwing it around at
and
Anthony and Aunt Jennifer.
Yeah. Good kids.
It was funny. They've had an interesting set of experiences in their life.
Okay.
Well, that was quite funny. And so Jennifer Hutt, she was hanging out, and I was playing poker with Anthony. I don't know where you went. Why? Maybe this was a different time. I'm not sure. But her husband came to pick her up, and he came in. His name's Keith Hutt. Just Google image him. And they're not good pictures. There's no picture that captures this guy. And he picked her up and he hung out for a little bit, shook hands and said hello to everybody. And then they left. And Anthony and I looked at each other and we said, almost at the same time, that's the best looking man I've ever seen in my life. And we were like, yeah, I know. He's amazingly hot. This guy is like some Greek god. And and then, of course, I said this is one of the guys
playing with penises.
Right, playing with penises. And then one guy got up to do karaoke, and there's just guys there. He's doing karaoke. I said, this is the gayest party I've ever been to. And it's not bad. It doesn't make you a bad person. I've kind of enjoyed it, but it was pretty much the gayest party I've ever been to. But, Keith Hutt, amazing looking dude. So when I would go on her show, she had a guest, I can't remember her name, or her producer's name was Sally or something. And when Jennifer would be done with me, I'd say, hey, Sally, or whatever her name was, do you know Jennifer's husband? And she'd go, yes, I do. And I'd say, isn't he the hottest guy you've ever seen in your life? And it would just embarrass the shit out of Jennifer. It was so much fun. But anyway, all right. Okay, so that's that. Let's see here. We have about 2,000 questions that we never got to. Scott, now that I finally made the video feed public, are there any questions in the waiting room? We'll do one of these.
Not yet.
Okay, all right. I've got Joe DeRosa. Okay, here's one. Oh, wait. Steve. No, this is one. Let me do this one. This is one for Dr. Scott.
Hey, Dr. Steve. This is Adam in Nebraska.
Hey, Adam.
How are you doing?
Good, man. How are you?
Good to hear.
Yeah, excellent.
Dr. Scott.
Hey.
How are you? Great. Glad to hear it.
Okay.
I was just calling to say thanks. was listening to your show a couple of shows ago, and you guys talked about mustard for heartburn or acid reflux. I don't get heartburn all that often, but when I do, I've tried a bunch of the over-the-counter medication, and it doesn't really seem to do a lot. After a day or so, it just goes away. But I was at the store and remembered your show, so I picked up some mustard, had it, and got some heartburn a couple days later, and so I got a big teaspoon, like Dr. Scott said, and took it, and it was gone instantly.
Yeah.
Heartburn and
Boo.
the burping and that
Amazing.
kind of thing. It was just gone.
It blows my mind.
And it was great. So I just wanted to say thanks. It really helped me out, and now I have a bottle of mustard.
Okay.
You're not the only one, buddy.
One thing, if you have that repeatedly, you've got to see somebody.
Of course, yeah.
This is for Dr. Scott will be the first to tell
yeah.
you. I still don't understand how this works. I was trying to get off my PPIs in this show one time, and I had horrible, just unbelievably bad rebound high pyrosis or heartburn. And I said, let's just, by God, try it. And I was all ready to just shit on it. And I got a teaspoon of yellow French's mustard, downed it, and really literally in 30 seconds it was gone. Now it came back, obviously. But it was an amazing thing. I still don't understand it because mustard's got vinegar in it.
Mm-hmm.
And it's got turmeric, at least some of it does.
Yeah, I think that's how it works.
It's amazing to me. But we've had so many people call in and say that. Obviously, anecdotal evidence.
Sure.
40 people call in and say it worked. That's 40 different pieces of anecdotal evidence. But I would love. Has anybody ever done like an actual randomized trial on mustard?
Why, hell no. There's no money in it, Dr.
But
Steve.
French's might
That's
have.
right.
There's no money in it.
Ain't no money in it.
If they could patent it and put...
There's no money in this. We've been doing it for 17 years.
Yeah, but we get to hang out with Tacie and, Lady Diagnosis and Dr. Steve. And
pyrosis.
Oh, yeah,
Let me look it up. Okay.
It's worth all of the pain and suffering.
The only thing I find here is reflux esophagitis in war-related sulfur mustard lung disease from like 1940. So, yeah, I see nothing.
Yeah.
That would be something for, if French's wants to fund a study, we'll by God do it.
Yeah. Yeah, we could do it. And it again, it's not
You'd have
curative.
to put it in capsules.
Sure. It's not curative, but it certainly does help to calm the storm when you're having something acute,
What about like a mustard kind of
Peel?
Herb?
Oh, herb.
Yeah, well,
Isn't there such a thing?
Well, sure, there is
mustard seed.
Well, there's mustard plants.
Yeah, mustard plants.
Does that help or no?
I don't know.
You don't know.
I don't know.
That would be an interesting way to dope out what was really helping people.
Yeah.
That's a good. I could actually do that because we could have some mustard seed. But I have actually taken mustard seed in a restaurant and crushed it up and dissolved it in water, and that does help a little bit.
Really? Well, there you go.
Yeah, sure.
So it's a great thing to talk about, I think. I mean, it's interesting to me. How would we determine, let's just say French's gives us $1 million. First off, okay, we're going to buy $100 worth of mustard. We still have $999,000.
I'm not working. We're not wasting $100.
Well, they give us $1 million.
We'll get one bottle.
One bottle.
Okay, well,
We'll
so that's $1.25. But then we got to figure out a way to do this as a double-blinded, placebo-controlled study. So you can't just give people teaspoons of mustard. So you'd have to put it in a capsule and then have a placebo that looks the same and feels the same and smells the same. So we could do that. The question is, if you did it in a capsule and it dissolved in the stomach, would it work just as well? And then you'd have to have them take a bunch of it to get a teaspoon. I mean, I guess we could do 2 large capsules.
Sure.
So that might be interesting to do, actually, now that I think about it.
We could actually, you can make it a lot stronger by...
we could boil it down.
Well, as they reduce it
and then
down.
if you reduce
pill.
it,
Yep.
you're going to be taking off some of the acetic acid, which may be part of what works, and that would be interesting
At least
as well.
that way you know, yeah.
Yeah.
Yeah, because, and I've heard people talk about taking apple cider vinegar for reflux.
To me, that's nuts.
Which makes no sense. To me,
adding
burn
more
the whole damn way down.
More acid to get rid of
People
acid.
take apple cider vinegar to lose weight.
Yeah, there's a company that's selling apple cider vinegar gummies as a weight loss
It's
thing.
kind of a cure-all.
Mm-hmm. Yeah.
So at this point.
Again, I just got to see the data. I'm all in favor.
But you can say anything on social media now, and everyone will try
These are
it.
commercials on cable television, too. You can say about anything on there, as long as you have the disclaimer at the end that you're not treating or diagnosing any disease, which is crazy because they just said this is for hair loss or this is for impotence or whatever. I don't know how they get away with it.
But we're not diagnosing or treating anything.
No, we're not treating anything.
As long as you say that, you're pretty much golden.
So you could say this stuff will, make your life perfect, and you will have giant meaty erections and all that. Oh, but by the way, we're just kidding at the end, and then I guess you're okay.
Yeah. Yep.
It's crazy.
No harm, no foul. Yeah, and I always tell people too, Dr. Steve, number one, check it out if it's new.
Yeah.
And number two, warm foods, warm drinks will calm the stomach, and yellow mustard will help.
Now tell everybody, and I find this to be very interesting, what your hypothesis is why warm drinks work better than cold drinks when you've got something like gastric gastroesophageal reflux disease.
Especially with GERD.
Because your explanation actually made sense to me. I had to go, oh, God damn it.
Yeah, well, give me I'm going for my first bill of the day. Please. Hey. So it says the stomach being a muscle, muscles like to be warm and active, and remember your body your stomach has two defense mechanisms when there's food in it. One's acid, one's motility.
Right.
And if it's cold and it shrinks, you decrease motility and increases acid.
Give yourself a bill.
Yes,
that's exactly right. That's a very compelling argument, actually.
And I don't know that it's ever been studied, but it makes good sense.
Yeah.
Kind of physiologically. So.
Yeah, at least it's not. Well, anyway, you're not just making up bioenergy fields like some people do. You don't do that, but there are people
only when I need to, but not all the time. That's correct. Yes, sir. Hey, we do have a question for Sean, though.
Okay.
Yep. Whenever you're ready.
Yeah, let's hear it.
All right, here we go. From our buddy Sean, my doctor prescribed me a calcium channel blocker, amlodipine. Since he started taking it, he's having flushing in his face and ears.
Ooh.
Is that from amlodipine? And what exactly is causing the flushing?
Okay, I know the answer to that. Dr. Ahmed, do you know? Amlodipine is a calcium channel blocker.
Yeah, it's a calcium channel blocker, so it helps with the dilation of the blood vessels.
Ooh, another
Give
one.
yourself a bill.
There you go.
So it can commonly cause things like peripheral edema in some patients.
Okay, so he's just got out of medical school. So, yeah, he means swelling in the legs.
Yeah.
Okay, go on. It's okay. I'll translate for you.
Yeah, and so it would make sense for me that you would have flushing because the blood vessels would be dilating.
Exactly.
Which leads more blood to reach capillaries. And so I think that would be the cause.
Mumtaz.
Thank you.
Exactly right. Yes.
Very good.
Yeah, very good. So, and these things usually will go away. Usually the body becomes tolerant to that effect, but not so much to the antihypertensive effect. Now, the swelling and stuff, if you start getting ankle swelling, that tends not to go away, and then they can put you on something else. I'd be interested why they put him on a calcium channel blocker. Right now, one of the protocols is to put people on angiotensin type drugs like losartan and drugs like that. They have very few adverse effects for the most part. Maybe you can get a cough from those, and a diuretic like chlorthalidone or something like that. And then beta blockers help to reduce heart attack and stroke, or mortality from heart attack and stroke. And what's funny, when I trained, if you put someone with congestive heart failure, and that's pump failure, their heart isn't pumping enough blood, so it's basically like a pump that's overprimed. It's backing up into the lungs, and they get fluid in the lungs, and they can't breathe and stuff. If you put one of those people on a beta blocker back then, it was malpractice in the 80s because the theory was that you were making the heart less able to pump, so you're making it worse. Now, if you don't put somebody on one, it's malpractice. It just shows how medical science changes over time. And the good thing about it, people say, whoa, see, you guys say one thing and then you say a different thing. No, it's the knowledge changes. We learn more and we are willing to change based on better data. And I think that is good science. So,
yes.
But it's just,
you would hope that you would change and evolve when you learn.
And that happened with COVID, and
sure.
But we saw it in front of our very eyes, and that's what the public isn't used to seeing. We're used to seeing things change based on a study, and then medical science. They have these meetings, and they all get together and they talk about what's the standard of care, and then it sort of changes, and it's really. That process is opaque to the patient. You just come in one day and now they're giving you a different medicine. Whereas with COVID, what we saw, oh hell, we're going to get I said the C word, we're going to get a content strike again on YouTube.
Don't use that word anymore.
Is that we saw it happening before our very eyes, and we're not used to that. And I think that's what freaked people out, because people's opinions changed very frequently because of new data that was constantly rolling in, So anyway, all right. What else we got? That was a good one, Dr. Scott.
Very good. Thanks, Sean.
Let's stay on the same topic.
Hi, Dr. Steve. I just had a question about my girlfriend. She has the valve on her stomach isn't working correctly, and she had to have her stomach inflated. I was wondering if you knew anything about that. Thanks. Bye.
Okay. Could be a couple of things.
No, he said it wasn't working.
Yeah, and then she had to have her stomach inflated. So I'm assuming that she may have had a couple of things. She could have had a stricture in her esophagus. That's what I'm going to assume this was.
Yeah.
So people with strictures in their esophagus, they'll eat stuff and the food, they'll complain food is sticking.
Yes.
And they'll eat and it gets stuck. And in those people, what they'll do is they'll go down and they will kind of inflate it with gas when they take the endoscope, and they give you some goofy juice, they put you out, and they'll pass this fiber optic scope into your stomach, and then sometimes they'll dilate that stricture. It could be scar tissue from reflux.
Reflux, yeah, like.
Or it could be other things,
Yeah, I was wondering if I'm sorry. I was just wondering if he was talking about her stomach not working like a gastroparesis.
Yeah, so a gastroparesis is when people's stomach doesn't contract enough, and stomach contents get caught in the stomach, and it is hard for it to get out, and they'll get nausea and vomiting and just feel bloated after eating.
How do they treat that?
Gastroparesis? That's a tough one. You can use motility agents. Diabetics will get it, and it's really hard to treat because the nerves that cause peristalsis actually have died. So in some of those people, you have to put in a gastric pacemaker.
What about a sphincter? Would he be talking about a sphincter?
Yeah. Well, her lower...
Do those ever stop working, like an LES?
Yeah, so the lower esophageal sphincter, thank you, Tacie. Well, you get one of these.
Give yourself a bill.
Is the valve at the bottom of the esophagus on top of the stomach, and so it's not a very good valve. It's just a little ring of muscle, and it's
a ring of fire.
It's often a ring of fire. That's
yes,
right.
It is.
Scott.
That's a good one.
And is it though? Yeah, it is. It was a good one.
It was a good one.
Okay.
It was.
I'll give him. I don't know what to give him though. I'll give him.
You've given out too many. Just
I know.
go on.
I know.
No, but if he gives me a
no,
bill,
you just.
we
You
have
know what?
two,
It's too late. You didn't know.
Two bills to 2 bills.
You lose.
Dang it.
Good day, sir.
Good job, Steve.
But those can get too tight. They can either spasm, and that's very painful, or it can get scarred down, like we were talking about, and cause a stricture there. So yeah, you would, if you had a stricture there. I had a. Let me rephrase that. I heard of a lady once who broke her hip because she had an esophageal stricture. Ahmed, you're nodding wisely because you already know what I'm going to say.
Yeah, I remember this story.
I've told this story probably too many times. But she had a lower esophageal stricture, and when she would eat, food would get stuck, and she would jump up and down. And that was great until it didn't work because the stricture was getting tighter. So now by the way, she's 80, and she would jump off the first step she had steps going up to the second floor, and she would jump off that first step. and then it got a little tighter, and then it was the second step. By the time she got to the fourth step, she fell and broke her hip.
Oh, boogers.
So that was a true story, and it just shows when you get something like that, don't try to fix it on your own. Go see your primary care provider. They can fix it. Go ahead.
I've heard more than one GI talk about how people get food stuck in their esophagus.
Yep.
Over and over and over and over again, and do
Yep.
little tricks like that to fix it.
Yep.
Until one day,
they can't.
Usually on a Friday night or a Saturday night,
That's right.
when nobody's working, they have to go to the ER and they can't get it fixed. And then you have to count on somebody who's off wanting to come in and take care of that. And that's not really something you want to do. So if you're dealing with that,
it shouldn't be done emergently, is what
yeah,
Tacie's
please.
saying.
If you're dealing with that right now, or you have your little tricks, or just go,
Yeah.
So you're not bothering somebody on a Saturday.
Well, yeah, and she's
Well, it's
right.
so it's not emergent.
Well, they get paid pretty well for being bothered.
Yes, they do,
Yes,
but they don't like it.
We're not
No, they don't like it,
empathizing
that's
with
true,
the GI.
You want your doctor happy.
Right.
Yes.
We're not empathizing with the GI that charges you $5,000 to come in to get a bolus of chicken out of your esophagus. But
You wouldn't believe.
I know.
I mean, they don't like it.
No, they don't.
No.
But at least they are compensated. But she's right. The process, at least the procedure, if it's done in a non-emergency situation, is pretty well tolerated.
Yeah, that's right.
Yeah, and it's pretty straightforward. But I will tell you this: we use needles and stim for gastroparesis pretty effectively.
Really?
Sure do.
Is there data on that?
What?
I would love to see it. I'm not challenging
no money
you.
in it, but
I'm not
I can only
challenging
tell
you. I'm just asking.
There may be, but I did it. All I can tell you is that I know for a fact that it does work pretty well.
Well, I'm going to by
Needles
God
stim,
look it up because it's coming up.
Well, there can't be any data.
No, there's tons of it.
Is there really?
Yeah, acupuncture. Why do you not know this?
Well, by God, look at you.
I don't have to look it up. I know it.
Okay, true.
Oh, thank you.
Fair enough.
Thank you. Acupuncture for gastroparesis.
Here's
Thank
32 studies that involved a total of
You get another
2,601 patients. Acupuncture was manually stimulated or electrically stimulated. The etiology of gastroparesis, the cause was diabetes or surgery. And let's just see what the answer was. Low certainty evidence for short-term benefit with acupuncture alone or acupuncture. Well, that's okay. It's,
better than zero.
There is evidence of publication bias, and positive bias of small study effects. That's always going to be true when you've got like 8 patients and you're an acupuncturist and you go, hey, I did 8 of these people. So that can't be helped. But it just says no conclusion can be made. That doesn't mean it doesn't work. It just they had a lot of studies, but none of them were high quality.
Sure.
So
and that's reasonable, and that's pretty standard in my.
It is.
world.
Unfortunately, they don't have data that says it doesn't work. Now wait a minute here. Clinical randomized controlled trial of acupuncture for treatment of gastroparesis. Here we go. Now this study was very well designed, and it showed a positive effect that was statistically significant. So we'll take that. And I'm going to be the first to shit on Dr. Scott if but these kinds of things, there are some real data on this.
Yeah. Well, cool. Thank you. Yeah.
And
I didn't look it up.
What harm's it going to do?
Exactly.
Somebody sent in a question the other day. We never got to. We'll just do a Dr. Scott show.
No, let's don't do a Dr. Scott show.
Someone was talking about what are these rings that people see, and we did this before, but we just had some Olympics, and now we're going to have some more Olympics. What are these rings we see on the swimmers' backs?
Oh yeah, that's made me a ton of money.
Yeah, okay. Yeah, see. That's why we don't. That's why he didn't want to shit on.
But I don't work
guys.
on Friday nights or Saturday nights unless
compensated.
It's Tacie calling.
I'm going to need some cupping
unless
on
it's
Saturday
Tacie
night.
calling.
Yeah, so talk a little bit about that. We got just a couple of minutes. We want to make sure Ahmed gets to say something.
Yeah, real quickly. Yeah, the cupping. The cupping is an old Chinese thing. We actually pull the skin, the fascia up off of the bone, off of the connective tissue, and it increases blood flow. And
So
we can leave those round marks if you want to. And
if you have tissues adhering to each other. This is the other thing. When Dr. Scott told me about this, it like clicked in my head because I said, how could this do anything? Yeah, you're bringing blood up to the surface, but you're just making a bruise. But what he said was, they grease them up pretty good. Then they get the vacuum in there, and then they can lift it up and move it around. You cannot massage somebody that way. You can't get your hand up under their skin and lift it up and get rid of those adhesions that are between the skin and the subcutaneous tissue and the muscle. You can't do that. No. But with this, you can.
Yeah, and post-surgical scars, it works extremely well.
It's kind of like those automobile dent kits where you put the suction cup on there and then you can yank on it and you can pull it back out again. Think of it that way, and then that makes sense to me.
Yeah.
I think that would really help.
It works pretty well on a lot of things.
For certain things.
Not everything. Yep.
Not going to help for my stupid back, for example. No.
So what exactly would that help?
We can't suck 60 years of wear and tear out of
ornery
of meanness out there.
Yeah.
That's right.
Yeah, Lady Diagnosis had a good question.
So what does it help if you do the cupping? Does it help like tight muscles?
Usually tight muscles, strains, ligament strains, tendon strains, post-surgical scars, boils. I've lanced boils and sucked them out of people's heads.
Oh, really?
Yeah.
You got to throw those cups away, though.
Oh, yeah. Yeah.
You throw them away every time.
It's
anyway?
Still fun. It's still fun.
Yeah, that's very satisfying.
Pus and stuff. Oh yeah, but typically 99 times out of 100, say somebody has a big scar on their back, they've got rods and fusions and stuff, and they've got the scarring. I'll put the cup right on top of that scar gently up and down. It just pulls.
Just lifts it up. Yeah.
What about lower back pain? You ever use it for that?
Every single day.
He uses everything for everything.
All right,
That's the
give
problem.
yourself a bill. I'm coming to see.
You got money. Give a bill.
Yeah, we need to have a thing. Give Tacie a bill instead of giving yourself a bell.
A bell.
So yeah, that's interesting though. I can I can see why that would work for certain things.
Something, not everything. Yeah,
cool. Any other questions from in there? Because I've got a couple here.
Nope. That's it.
Okay, let's try this one.
Hey, Dr. Steve, how you doing?
Good, man. How are you?
Oh, I'm doing just fine as well.
Good.
Quick question for you. This is Rob from Fredericksburg, Virginia.
Hey, Rob.
Oh, cool.
And I'm a longtime alcoholic and about to start a rehab program, and just kind of curious what you know about the withdrawal symptoms that I'm going to be going through pretty soon.
Yeah.
I'm already aware of the shakes and the sweats and just irritability and everything else. Just wanted to hear your thoughts.
Okay.
Love the show, dude. Bye.
Hey, thanks, man.
Cool,
and
man.
I hope this wasn't an emergency because he sent that call in about 8.5 months ago. I'm so sorry, dude. I had no idea what he was calling about. That's my bad. So hopefully he's fully detoxed at this point and everything is totally fine. But we've only got a couple of minutes, but this is what I want to say. Yes, he enumerated a lot of the symptoms of alcohol withdrawal. The thing about alcohol withdrawal is please don't do this on your own. Go to a meeting, but if you are a heavy drinker and you're at risk for seizures or for DTs, and how do you know? You don't. So that's why you need to do this under a physician's or a healthcare provider that's well versed in this. Do this under their supervision, and you can safely detox. You can do it. This can be done. There are friends of mine I never thought would ever quit drinking that now are completely sober. If they can do it, you can do it.
Same thing for Xanax and those kinds of meds.
Yes,
also.
benzodiazepine, same way. Do that under the supervision of a healthcare provider, because if you don't, bad things can happen. But just I hope he's well, and if you're not, call us back and we'll try to get your call on a little bit sooner this time. I'm so sorry. Anyway, thanks for being here. It was a little bit of a cluster F of a show. I have been running my ass off all day, and it's no real excuse. I mean, I've been broadcasting forever, and I still can't put together a decent show when I've had a stressful day. But anyway, I appreciate you all hanging in there. I hope you had fun. Dr. Scott, thank you, sir.
Thanks, sir.
Lady Diagnosis, great to see you.
Thank you.
Tacie, you are lovely as always.
Oh, I know. Thanks.
Thank you. And Ahmed, shukran Siddiqui.
Afwan, shukran Dr. Steve.
Barakallah hufik.
Thanks. And thank you for having me.
Hey, thanks for being here, man. No, for real. It's amazing to finally have you in here after all these years. It's crazy. when you think about it.
It is fun. I remember when he called in.
I do
years
too.
ago, yeah.
I made a big deal out of it.
We're blown away.
He's going to go to medical school because of this dumbass show.
He wasn't as cool as the gal from England with a pretty accent, but he was still pretty cool.
Right.
But you're okay, though.
I agree with you.
Well, we can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, that Gould girl, Lewis Johnson, Paul Ovcharski, Chowdy 1008, Howdy Gooplunk, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, the St. Pete Barkeep Blower, the Dolly Museum Diddler, the Ballet Bimbo, the girl with a genetic half-sister no one knows about, Pertsy Dumb, Roland Campos, sister of Chris, Love It, a.k.a. Patty Blue, Sam Roberts, she who owns pigs and snakes, Sean P. Oh, by the way, I got to stop right here. So Sean P. is coming to Rochester to the roast.
Oh, wow.
Yeah, so Sean, we got to talk. Pat, you're not staying in my room, dude. Pat Duffy, Bill the Cop. Well, okay, if I get a double queen, it might be okay. Keith the Cop, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's voice double, guitarist Steve Ducci, Steve Ducci, that's not his name, Steve Tucci, the great Rob Bartlett, Adam Goldstein, Cowgirl Vic, thank you for your service, Cardiff Electric, Casey the soil scientist, Carl of the Talipes Equinovarus Carls, producer Chris, the subreddit news chick, a.k.a. That Broad, Crows and the Bukkake Queen, Jenny Jingles, the Inimitable, Vincent Paulino, everybody, Eric Zane, Trucker Andy, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends, G-Vac, Barry the Blade, and Todd Hillier, who supported the show, was always gracious and always appreciated. They're very greatly missed. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sundays at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. And Ahmed, this is for your mom. El Ered Fiain Omo Gazal.
She would agree.
All right, take care, everybody. Thanks.
Goodbye.
Thanks.